Hi guys, this is Dr. Aravind and I'll be speaking about the coronavirus today. I'm a diabetologist practicing in Bangalore and also happens to be the president of Diabetes India. Well, coronavirus is a large family. It has a lot of cousins and so many others at home. And then this is not something new, but the 2019 novel coronavirus was identified in Wuhan, China. And this was previously not seen in the humans. It's highly contagious and spreads extremely fast. And you know that it starts with a common cold, fever, cough because it affects the lungs and ends up resulting in respiratory failure. There is much to learn about this newly emerging COVID-19, including how it spreads. Based on what is currently known, trust me, COVID-19 and its relatives spread mainly through a person-to-person contact, what we call as the droplet infection. When somebody sneezes or cough, the virus is there in the air, and when you come in contact with it, you actually get it. It may also spread through airborne transmission when the tiny droplets remain in the air even after the person with the virus leaves the area. One sad thing is the confirmation of this is only through laboratory testing at this point of time, and I'm sure we'll have rapid tests available soon. Now, what are the symptoms of this particular disease? Most of you already know it. It usually starts with cold, cough, and fever. And there are also cases where it has presented as cardiac failure and encephalopathy, but these are generally rare. What you see is cold, cough, and fever. And breathing difficulty can be one of the earliest symptoms. So if you have any one of these, please contact your doctor fast. Now, who are at risk? Well, the elderly patients, people with diabetes and comorbid conditions like hypertension and cardiac problems, patients with cancer who are on chemotherapy, and people who are also taking steroids for asthma and other conditions, because, friends, there is low immunity in this set of people. It's mainly the defense to fight the virus is low in this group. Now, we talk about humoral and cellular immunity, and it's told that people with diabetes are low in both humoral and cellular immunity. There appears to be two reasons in people with diabetes. Firstly, the immune system itself is compromised because of diabetes, and that makes it harder to fight the virus and likely to spread faster and remain longer. Secondly, the virus may thrive in an environment of elevated blood glucose. Now you know why you have to keep your sugars under control. Now, what are the general guidelines? And all of us have been reading about these general guidelines all along. Thorough washing with soap and water, it should be done as frequently as you can. Well, you can use alcohol-based hand rubs, but if you don't have it, please don't worry, soap and water will do. Please practice proper respiratory hygiene. Cover your mouth with a mask. Please avoid touching the mouth, nose and the eyes. And this is something very important. Stay away from a person who has been contacted or known to have traveled to a country with this COVID virus being a big problem there. Well, avoid all non-essential travel. Now, even in lockdown period, unless it's necessary, do not leave the house and follow the social distancing. Avoid going out for fun just to see what is happening on the roads. And if anybody in the house develops fever, cough and cold, please take them to the doctor as soon as you can. Now, there are specific guidelines regarding the blood sugar values. You have to have a proper diet and you have to eat right and follow the diet instructions received from your dietitians. Please avoid sweets and simple carbs as much as possible because they are known to increase your glucose values. Exercise indoors or you go for a walk if you have a compound within your apartment block. Monitor blood sugars as often as you can. Keep the fasting less than 120. Post breakfast, post lunch, post dinner less than 180 at all times. SMBG, self-monitoring of blood glucose as often as you can. And stock up your medicines and insulin at least for a week to 10 days. Luckily, they are not out of stock. It's available. Now, many people ask me the question, Doc, how do I improve my immunity? Well, good nutrition definitely has proved that it can improve your immunity. A high protein diet is what is being recommended. Please increase your protein intake in your diet. And there are also reports that vitamin C and D3 levels can also improve the immunity. So talk to your doctor before you decide to take vitamin C and D. Well, exercise is one proven path to improve your immunity. So please go for walks at least 30 minutes a day. And this is something that all of us can do. People have been talking about yoga and meditation. Well, we don't know whether there is an absolute evidence, but meditation and yoga will certainly improve your mental health. and mental health can directly have an effect on your immunity. And I sincerely believe that yoga and meditation can help. Well, we have also been talking about hydroxychloroquine for the last couple of days, but I want to make it very clear now. The National Task Force for COVID-19, which was constituted by Indian Council for Medical Research and with the help of the Drug Controller of Government of India, recommends the use of hydroxychloroquine for COVID-19 infection in high-risk population, which basically includes doctors and paramedical staff. It does not include every person. It includes doctors and paramedical staff who are likely to come in contact with patients who may or may not have COVID-19 infection. So these asymptomatic healthcare workers involved in the care of suspected or confirmed cases of COVID-19 have been asked to take 400 mg twice on day 1, followed by 400 mg once a week for the next 7 weeks. Now, this is the recommendation. It is not to be taken by everybody. But if as a diabetic, if you are already on hydroxychloroquine, or if you have rheumatoid arthritis or any other skin condition, if your doctor has already given you hydroxychloroquine, please continue it. Or if you are likely to come in contact with a relative or a friend who may have COVID-19, then talk to your doctor and you can also start prophylaxis. I'll be coming back with bits like this more often. If you have any questions, you can please write to us and then you will be given the email ID. And I'll be happy to answer all your questions. Until then, stay home, stay safe, stay clean. Bye bye from Dr. Aravind.